Well, hello, everyone. My name is Darren. I'm one of the marketing coordinators with BCIT School of Health Sciences, and it is my pleasure to welcome you to Health Sciences information session for the Health Leadership Advanced Certificate Program. First, I'll just say how happy we are to see you all, and thank you for attending our presentation today. I just want to say that the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. I just want to right now invite Shan to introduce the department.
Hi, everyone. It's Shan Chadaglu here. I'm the program head of the Healthcare Management Department, and I'm so happy to see you join our conference, our call this afternoon about the Health Leadership Advanced Certificate Program. So first of all, I'd like to tell you about our department. We have been in the School of Health Sciences for about 35 years, and the program has gone through many stages of development. Our mission right now as a program within the Institute is that we inspire and educate health leaders who wish to develop their leadership and management skills to foster positive change for a sustainable health system. So our program and our department focuses on working health professionals who want to advance their careers. We provide evidence-informed education to support their development. Also, since leadership is also really a people sort of activity, we also work to inspire our students to proceed, make connections with each other and with their own field. So welcome. Thank you all for joining today. So on the next slide, you'll see the agenda. This is what we have planned for this evening. We just completed the welcome. We're going to have about 5 to 7 minutes later on to do some roundtable introductions. Normally, we do these introductions in person when we do these sessions on campus, but because we're doing this on Zoom, we'll be doing the introductions in the chat tool in Zoom. After that, I'll start the presentation portion of our evening, where I will be talking about health leadership, the importance of health leadership for advancing the health system in Canada and in British Columbia. Then I'll be talking about career stages of development for health sciences, health professionals. And then we'll talk about the health leadership program itself, and we'll have about 10 minutes at the end for Q&A. And it's not just me here on the info session this evening. Darren is our MC. I'm presenting most of the material, but we also have Victoria Banham, who's our program assistant, Janice Pointes, who's the lead program advisor for BCIT. And we have Aaron and others from marketing within our school. So let's get started. Just going to the next slide, let's do this roundtable introduction session using the Zoom chat. Now, this is a discussion that's happening through Zoom, so you don't need to state your name. But I would really appreciate for each of you to open up the chat tool, which you'll see at the bottom of your Zoom screen, and just type briefly your role, your background, and where you're located, like what city or province that you're in. So if you could just take a few moments, open up the chat tool and post that information there. This will be shared among all of us, and we'll be able to see who else is in our conference today. Interesting backgrounds. Thank you for posting. Like Kathy is the program administrator in medical education. Melissa is involved in recreation therapy in Surrey. Others that are popping up here, you'll see Michaela is in Burnaby as an RN. Oh, interesting. Research coordinator, site lead for the Victoria Clinic. Stephanie is in Richmond, an RN with VCH. Arden in Coquitlam, midwife. Kudrit, mentoring coordinator for a nonprofit organization, degree in health sciences, very interesting. Christina Oakwood, Oakwood Community Center manager. recreation therapists, quality improvement. We have some from the dental profession, some additional people on the call who have a nursing background out of the Lower Mainland in Vernon. Another with the clinic with a research related background, clinical research associate, MD in Surrey, pharmacy tech in Richmond, another health sciences grad from SFU in a managerial role in the retail sector. Okay, that's great. Thank you all for sharing a bit about yourself. See, one more just came in, an LPN with a Bachelor of Science from in nursing from India and working towards an RN in Canada. So yeah, thanks. That's really wonderful. It's really great to see the breadth of people's backgrounds as well as the roles and locations. So thank you for that. So let's proceed to the next slide, where I'll start the presentation for this evening. So this is a future vision statement from the perspective of our department in health sciences in the healthcare management department. We believe that the future of the health system will be certainly more patient and family oriented, with more focus on prevention, more accountability, the use of interprofessional teams, and because of demographic changes, we'll need to be serving an increasingly older population. And I think when I speak with a lot of our students and others who are in the health professions, one of the key questions that come up is, with this sort of new system, who are going to be the leaders in this system? Will the system be led by people with clinical backgrounds who really understand the day in the life of health services? Or would it be kind of a mixture of other people? So if you go to the next slide, Darren, please. So in terms of the health system, if we look at how Canada compares internationally, this was a study done by the Commonwealth Fund in 2017, showing how Canada compares to some of the other highly industrialized countries. In this ranking, number 1 is the best and number 11 is the worst. And based on this assessment, you could see that Canada, like we kind of really, we compare ourselves to the US, and by that comparison, we often are really quite impressed with how we're doing. But on an international scale, we're not always at the top. It depends on which attribute that we're looking at. But clearly, this shows that there's room for improvement. Going to the next slide, please. And this next slide shows similar information, how Canada does compared to other countries. In this case, comparing the cost of healthcare delivery and how well the system is performing. So we're kind of in the middle of the pack in terms of spending, but in terms of performance, we're not quite as high as some of the other countries. So there is room for improvement. Next slide, please. Now, if we go from a national to a provincial level and look at what is the areas of priority in British Columbia, one easy way to find this information is to take a look at our BC Ministry of Health Services plan. This is a plan that spans 3 years and it goes until the end of the 2023 fiscal year. And we can see here that there are 3 main goals for this services plan to ensure focus on service delivery areas that need to be adjusted and repositioned on areas like primary healthcare services, team-based care, seniors, community, mental health, substance abuse, and timely access to surgical procedures. Also goals like focusing on population health, making sure that there's constant quality improvement in various services, hospital and diagnostic. And then thirdly, making sure that we do the best with the resources that are available, not always having new resources, but really focusing on value and sustainable health systems. And that also includes how we train health professionals and how professionals work together. So these are some areas to focus on. And usually when people finish their first healthcare professional credential, the focus is really on one's own profession. But when you kind of take a step up and look at the broader system perspective, there's certain goals that are really important, and the system to kind of organize around those goals to make the improvement. So oftentimes when things are challenging and there are lofty goals to achieve, it's quite easy to say, well, we just need more leaders. We need better leaders. Next slide, please. So this is a kind of a tongue-in-cheek comment from a classic leadership expert. Leadership is like the abominable snowman whose footprints are everywhere, but is nowhere to be seen. So it's really easy to talk about, but really tough to do. If you just, next slide, please. If you take the notion of leadership and try to find out what really is it, what does it involve, you might look in a card catalog in the library back in the old days, or next slide, please. Search in Google, search in Amazon, and see all the books that are available. There are a ton of things to look at in terms of leadership. It's almost a bit of a fad, so you got to be careful about that. Next slide, please. But this is a definition that I really like, and I think it relates to the kind of teaching and learning that we do in our program. Leadership is accepting responsibility for enabling others to achieve a shared purpose in the face of uncertainty. So you can imagine or just reflect back on this last year and a half with the pandemic. Certain people really have stepped up in terms of leadership, and there's certainly a lot of uncertainty and trying to achieve a direction and a meaningful movement towards goals that are important to everyone. Next slide, please, Darren. So that's it for kind of a high level perspective on leadership. Now I want to talk about our department. You saw our mission statement, which I mentioned before. Next slide, please. So BTIT's Healthcare Management Department has been around for about 35 years. In recent years, we launched a Health Leadership Advanced Certificate, but in prior years, we had credentials in a number of areas, including informatics, quality improvement, clinical trials, and so on. But the Health Leadership Certificate is our flagship program now. Next slide, please. If you proceed to embark on studies with BCIT in health leadership, this is a profile of the kind of students that you'll be working with. Our students currently in the program, based on training, you'll see about half of the population of students have an allied health or related background. There's about a quarter with a nursing background, and then another quarter with health sciences backgrounds from SFU and other universities. And there'll be also a segment of about 10% or so people with graduate degrees, Masters of Arts in various areas, Masters in Public Health, Masters of Science, MBA, MD, PhD, and so on. So it's a really diverse mix in terms of the education and training that people have, even prior to embarking into studies with our department. Next slide, please. And our students are also really diverse. You can see here the students by field. The fields that are listed in blue, these are areas that BCIT actually graduates into. So we have, I believe it's one of the largest nursing programs in the province, the largest medical radiography program in the province, med lab, clinical genetics, and so on and so forth. But we also have in our program people from other health disciplines like pharmacy, respiratory therapy, physio, gerontology, social work, long-term care. We have some nurse practitioners in the program and some people who are in the startup health digital health world. So it's a really diverse audience. Next slide, please. And in terms of age, our students are kind of around 37-ish, plus or minus 5 to 7 years. So it is quite a diverse cohort there as well. People who are relatively new in their professional career and others who are quite experienced up to around 15 years. Next slide, please. So with all that diversity in our program and also progression, you might wonder, like, how does my thinking about yourself, how does my development currently fit into a program like this? How can a program like this help me to advance my career? Darren, could you just click 3 times and fill in all those boxes there? So starting at the bottom, when you first enter into your studies, you set the foundation, usually with your first academic credential. Um, uh, then you enter into the workforce. It usually takes about 2 to 7 years to just get started in a kind of a professional way in terms of working, getting life sorted out, and so on. And then people start to think about how to advance further. And then there's the rest of your career to advance and lead as part of the system for systems change. So although generally there's quite a lot of focus at the beginning of the stages of academic study in one's career actually goes on for a much longer period. So a program like ours at BCIT could really help you get on that pathway. Next slide, please. And on this slide, I just wanted to illustrate that back in the day when people first entered the field, it was really quite a linear path. You kind of get more training in your area. But over the years, and even currently now, there's so many different ways to evolve a career from the linear path for sure, but also changing between organizations, maybe from one geographic location to another. Sometimes there's a broadening, so going from like a frontline contributor with a clinical background to becoming a project lead, a coordinator, an administrator, a team lead, maybe in other areas. And there are also people who, for whatever reason, they need to go in and out of the workforce. So they work and then they take time out of work to study, go back to work, and it's a kind of a iterative process. So certainly things have become more dynamic in terms of careers. Next slide, please. So that's where a program like ours at BCIT, the Advanced Certificate in Health Leadership, comes in. Next slide, please. This program on health leadership is designed to be flexible for busy adult learners. The program is offered online with a flexible cohort system. There are 8 courses spread over 2 years. The level of study is upper baccalaureate level and a little bit beyond that. We referenced the Leads in a Caring Environment framework, which is like a competency profile developed in Canada for health leaders. After completing the first half of the program, which is the first 4 courses, you get a statement of completion. And then after completing all 8 courses, you get the advanced certificate. In terms of entrance requirements, the minimum academic entrance requirement is a health sciences diploma, a 2-year diploma, or a bachelor degree in any field with relevant work experience or even higher credentials. And as you saw previously, about half of people in the program have a baccalaureate degree already. English proficiency is also an entrance requirement. And in addition to this, essential for success in the program is having sufficient work experience so that you can bring the experience that you have into your learning in the online program with your classmates on your projects, and to link the learning back to the workplace so you get practical use. So if you just finished a program and haven't really kind of dipped your toe into the world of professional life, a program like this might be kind of premature for you. But after getting some experience, then it becomes a really more optimal place to take a program like this. It's important to you as well as to us that you get really good value for money for a program like this. Next slide, please. So in terms of our courses, all of this information is on the website, and you can read the course descriptions, the learning outcomes, and so on and so forth. But courses are divided into 2 years. The first half really sets a foundation for the second half of the program, although we don't impose tight restraints in terms of prerequisites between the different courses. But what we have here is an essential set of courses for health leaders in Canada. The last course that you see on this list called the Integrative project. Next slide, please. Can you go one more slide, please? The Integrative project is a capstone organizational consulting project that you do in the workplace with an organizational supervisor. The supervisor, the organizational sponsor could be your boss. It could be your boss's boss or somebody from a different part of the organization. If students happen to be in between organizations or in between jobs, the sponsor could also be the health professional organization. And in this course, the aim here is to integrate the learning from the program and focus on a challenge or an opportunity that's of importance to the sponsor, but also gives you a chance to exercise your learning, to demonstrate your learning to a sponsor, and to create some visibility for the learning that you've done through BCIT. People also leverage the integrated project to get a professional paper written and published, to present at conferences, to present at the board of the organization, or to use as part of your portfolio for going on to graduate studies later on. Darren, could you go back one slide, please? Backwards, yes, to this one. So in terms of the coursework in the program, there's a balance between individual work and team projects. Individual work is more the emphasis at the beginning, and then as you go through the courses, you have more collaborative work, interprofessional collaborative work with other health professionals and team projects. So there's quite a variety of the learning methods that we do, but we're also really cognizant of people's workload and the need to have control over your own work, but also the reality of health leadership, of doing things with and through others. So we strike a balance between both of these. And then the final integrated project is work that you do yourself, but you will have a sponsor and you can also bring in other participants. Darren, could you go 2 slides forward, please? So in terms of the integrated project, here are some keywords associated with these. Typically, people do projects in areas that relate to their area of expertise. So medical laboratory, long-term care, mental health, pharmacy, nursing, and so on. But also projects may relate to certain aspects of the work of the organization. So for example, looking at workflow and process improvement, looking at program evaluation policy or evaluating services, focusing on healthy workforce, safe working environment. Training and onboarding is a frequent topic that comes up with succession planning, standards and guidelines, organizational change, and involving the patient voice into the organization. So this is kind of some general categories of how students focus their integrated project. Next slide, please. So here's a sampling of some of the projects that students have done in the past. You can see just from the description, these are really quite detailed. Every project is really quite different. Hematology, CT imaging guidelines, Kanban implementation in medical laboratory. We had a few students who were overseas doing projects in their areas and so on. Next slide, please. More work in lean, project tackling stigma in emergency room, a lot of e-health, electronic medical record related projects and so on. Next slide, please. So, so you can see there's quite a lot of range that you can do in your integrated project with your sponsor. In terms of faculty, the faculty for the program, it has a combination of regular faculty, such as myself. I teach several courses in the program, and as well adjunct instructors from executives and mid-level leaders from the BC Health System. All faculty have master's level training and above and experience, and sometimes additional qualifications. So there's really a kind of a diverse range of perspectives from the faculty that are brought into the course, as well as from your classmates. Next slide, please. So the program is endorsed by the Canadian College of Health Leaders and Emerging Health Leaders. Next slide, please. And as well, we have some partnerships externally as well as internally. So within BCIT, students who are in the Bachelor of Health Sciences MRI option take the course from our program as a required course. Students who are involved in the project management program, the applied data analytics, as well as technology management, take courses from this program as electives. So currently this term, for example, we have a course on evidence-informed choice for health leaders, and it's a class of about 22, and 3 students are from the analytics program at BCIT. And that's a really interesting mix because our students are not data and IT sort of people, but they're able to work with cross-functional teams with students from other programs on projects and topics of importance. So definitely an interprofessional learning environment. Next slide, please. So this is the annual schedule of course offerings, and this is a slide maybe to take a bit of a pause and address. Um, we have 8 courses in the program, and we don't offer all 8 courses all the time. We offer them in a really tailored, specific way. And so, for example, if we look at the 2021 calendar year, which is this year, we have 7110 and 7120 offered in January. And if you start this cohort in April, you would do 7130. In September, you would do 7140. And then in next January, you would do 7250 and 7270. And then April, you would do 7260, and then the final project, 8280 in September. So that would fit within a 2-year period. But you could also see there are these additional sections that are listed. So it turns out 7110 is offered 3 terms per year. So it's basically offered all terms all the time. But other courses are offered only once per year. So we have built in additional redundancy into a schedule like this so that if it was that you didn't start in the January start date, you could actually start in other terms in the year and either be a little bit ahead of schedule or a little bit behind schedule. But in any case, there's enough wiggle room in the calendar that you could accommodate your needs. So people, in fact, start the program at all points during the year. And it's when January comes around, we associate people with a cohort so that they can build teams and so on and have the similar classmates as they progress through the program. So if you have questions about the annual schedule later, we can come back and talk about that. Next slide, please. In terms of the program and the costing, the tuition per course is around $886. There's a $9 student services fee. The textbooks can range depending on the course. The first course includes an additional text that's used as a reference for later courses, so the price for the text there are a little higher. If you order from BCIT, there's a shipping fee. It varies depending on your location. This is the average shipping fee. So adding all that up per course and then the total on the bottom, it's around almost $8,000 for a program over 2 years. Next slide, please. And if you compare the pricing for this sort of education and this sort of course that we have at BCIT to your undergraduate studies, on a per credit basis, it tends to be around just more than double. And the reason is because when you did, say, for example, a 2-year diploma in health sciences at BCIT, half of that studies was actually subsidized by the government because early career learners deserve to be supported through their education. But after you enter into your field, then it's more you support yourself. So if you compare studies here to the undergraduate, it's higher. But as you compare with studies in, say, executive level leadership programs, like an EMBA at UBC, a Masters of Arts in Health Leadership at Royal Roads and others, the price tag there tends to be 2.5 to 3 times the price per credit for more kind of a premium price structure and a premium experience. The way we've designed our program, like I mentioned earlier, is to be flexible and very accessible. So we're kind of positioned this kind of in the middle of the spectrum in terms of pricing, but quite clearly to be really accessible to all. Next slide, please. So if you decide to pursue this program and you do start taking courses in the program, we have specific expectations for student progress. And we think of our students as in one of two categories. One is students who have formally applied to the program and being formally accepted to the program. These students are in the program formally. They're on our list of students. So whenever there are opportunities to share, say, referrals to attend a conference or to a mentoring program or to do networking with other students. We will be reaching out to these students because they're on our list of people who are in the program. People can also take our courses in more of an a la carte format. So, I really needed to take that project management course because a project is happening at work and I need to be familiar with the subject. So people can take individual courses a la carte, but they're not formally accepted into the program. We call these an undeclared major. And that's okay because sometimes people do really have a practical short-term need for one specific course. And if there's no restrictions on that, usually people can take those courses. Next slide, please. But here's the same information in a bit more detail. If you're accepted to the program, the minimum level of progress that we expect is that you take your first course within the first 6 months of having been accepted to the program. So don't get accepted to the program and just not get started. That's not really great in terms of your own plans and commitment. And it's taking a seat that could have been used with somebody else. The second milestone is to attain the first 4 courses in the first year, and we'll celebrate this with a statement of completion, which we'll send to you. You can add it to your LinkedIn or to your professional profile. It's not an academic credential, it's an acknowledgement that you made it to the halfway point. The third milestone is to start thinking about the Leadership Integrative project. This will be at the beginning of the second year, where you will start to think about what are the key issues in the workplace that my organization feels is a priority. Who can I bring on as a sponsor, and would the topic fit within the criteria, the requirements of the course? Have a call with me. Maybe I can help you sort through some potential topics and think about some strategies for that. Send in a proposal. Once it's approved by BCIT and the sponsor, then you'll be gearing up to do that as your integrated project at the end of the program. And the final milestone is to complete all 8 courses within 2 years and complete the final project. And then, next slide, please. If you proceed as an undeclared major, this is the kind of path where you just pick and choose a couple courses a la carte. We ask that you try to be really deliberate, maybe within the first year, try to decide if this is a program that you want to do. And stay in touch with me, reach out, and maybe have a chat to discuss, how your decision process is coming along. So next slide, please. So in terms of next steps, there's a couple things that you can do. First, you could take a look at our website, make sure that you read all the information there. People can apply to the program at any point in the year, and all the information is on the website. As well, if you want to try a course to see if you like it, you can enroll in certain courses in this kind of a la carte undeclared format. As well, through BCIT, there's program advising where you can get individual consultation or referral to our department if you need more information. And as well, through our department, we have a web form on a website where you can request an assessment. You could put in a bit of your biographical information, your goals. The message will come to me, and I can take a look and respond by email to you to just offer some tips or to confirm that this is the right path for you, or maybe wait a couple years, that sort of thing. And as well, we have a newsletter, so you can sign up for that. Next slide, please. So we're getting near to the close of the presentation. I just wanted to go through some excerpts. These are more testimonials and comments of what people say. And you might think of your own perspective and how it would be for you to be in these shoes in terms of speaking out on where you're at in your career and your goals. So this person says, I'm an X-ray tech on Vancouver Island, hoping to get some professional experiences talking about how it's easy to get really focused in one's own specialty, but looking for opportunities to interact with people from different backgrounds. Next slide. This person, I believe, is a med lab technologist, providing expertise to quite actually a large number of people, being in the field for 10 years. Next slide, please. This person is an RN based in Quebec, is at the stage in her career where she's precepting, mentoring students, kind of really setting a tone for new people entering the field and wanting to link that sort of stage in one's career to more development in health leadership. Next slide, please. This person is a new med tech, 2 years of experience in a leadership role, but commenting on the challenge of leading others in the department when they're actually the youngest in the department. So depending on your field, that could be the natural state of things, and that's always an interesting challenge. And so on and so forth. I'm not going to read all of these. But we're getting to the point in our information session where we'd love to hear from you in terms of questions and answers that you have regarding the presentation. I'm happy to go back and comment on things. And just as a reminder, we will be sending this deck and other information back to you through email. As well, I run this session several times per year, 2 to 4 times per year. So if you do want to get more information, there's always ways to get information. But let's hear from you in terms of your question. You can raise your hand like Parvin has just done, or type into the chat. Let's hear from Parvin. What's your question, please?
Hello, good afternoon. Thank you so much for the very informative actually info session. I've got lots of information actually. You know, I have 2 questions. One is about my career because I'm a midwife, but I have my bachelor degree in midwifery from Iran, not here. And I'm not working as a midwife here. I'm a program coordinator in a nonprofit organization. So I'm wondering, can I apply for this program or not? That is the first question. And the second question is about the career opportunity for this program, this, job, and comparing with health, public health inspector, because I'm wondering between 2 of these to go with one. So I would appreciate if you could, advise me about 2 programs like health leadership, and then another one is public health inspector, like that. That is my 2 questions.
Okay,
If
thank you.
I
Yes.
to make more clarification, let me know, please.
Yes, sure. Maybe at the first point, just in the interest of time, I suggest getting in touch with Janice in her department after our conference to explore health leadership, but also the environmental health, public health inspection program. And secondly, from a health leadership program perspective, I've seen people come into the Canadian environment. It's also really important to get an understanding of the landscape for healthcare in Canada. And the second course in our program is called the Canadian Health System course. So that course covers the system, and which is quite often helpful for you to kind of align your career in a good direction. And as well, using that as some initial education to start your planning. So it may not always be great to kind of jump into a whole new program if you're still conducting research. So taking a course to get that learning is probably a really great investment to get that knowledge and then evaluate what the next step would be. Thank you, Parvin. Other questions?
How about my, career? Do I need to be a healthcare worker to apply for this program? Like, because I'm not working in the health system, I'm a midwife, but here I'm doing like program coordinating in nonprofit organizations.
So when I presented the list of 8 courses, and you'll see this in the slide deck, 3 courses are available to take without being in the program. So those courses you can certainly go and enroll for just purely for the sake of learning from that course. And then uh, uh, in terms of taking the whole program, you would have to meet the entrance requirements, and those can be done from reading the website and also getting support from the program advising office to make sure that the documentation that you have meet those requirements. So that's generally the process to follow. And maybe this is something that we can interact with you after the conference. Yeah, thank you.
Okay.
Other questions from the group? See, there's a lot of questions here in the chat as well. I just want to make sure that I provide some attention to these ones as well. Let's see, there's one question. Are courses scheduled as synchronous or asynchronous? That is a great question. For the most part, courses are asynchronous. And what this means is that you don't all have to be in class at the same time. This allows you to control your schedule, to meet deadlines in a course, either your own personal deadlines or deadlines that are based on teamwork. But you can control your time throughout the courses. There are a few activities that are synchronous, like a video conference. And for those, we actually record those conferences so that if you can't attend, you can still listen to it later on. So we design exactly around this balance of synchronous and asynchronous. That's a great question. Another question here, can I take 2 courses at a time, or is it better to do 1 at a time? With the schedule that we've designed, the most optimal way that we've sorted this is that you would complete 8 courses over 2 years, and BCIT has a 3-term system. So that means at least once per year, you would be doing 2 courses at once to finish within the 2-year period. So most people find that level of workload is really quite manageable if you're working full time and juggling family and other issues.
Jan, there's a question below my answer, which is, do any of the courses include financial management in the curriculum?
Yes, that's a great question. Maybe Darren, you can dial back to the slide deck where the 8 courses are listed. The 7140 course is called Sustainability in Healthcare. That is our healthcare financial management course. So that includes basics of accounting, financial management, and some case studies with a healthcare focus, including the standards that are in healthcare and the unique operating environment that health professionals at healthcare works within. Question, do we do courses in the numerical order? You can do them out of order. Whenever you see the annual course schedule, courses that are scarce, like they're only offered once per year, if you have a chance to do it, you should probably do it because you would have to wait for the next year for that to come around. Courses that are offered every term, you could take them when you can, but you could also use them to fill in gaps later on. Generally, it's good to do 7110 and 7120 at the beginning because they are kind of like an overview course. And naturally, the integrated project, you wouldn't do that too early. You would do that at the end, so it gives you a chance to integrate your learning. Question about in-person learning. The courses are all online. At this point, we don't imagine having any in-person learning, but after the pandemic is done, we might have some other sort of events, but they would not be academic oriented, more professional networking, career development sort of activities. Question about workload. How many hours per week per course? So these are all 3-credit courses. You can think back to your undergraduate days, how much work went into a 3-credit course. We adhere to the rule of thumb of about 7 to 9 hours per week per course. In all aspects, reading, writing, working with your team, discussion posts, et cetera, et cetera. How will the program be of use to the dental field? And then another question about English requirement. The English requirement is all well defined in terms of what those are and what thresholds to meet and what documentation will support that. I'll refer you to the website for that information or to the advising office if you need extra clarification. In terms of relating the course to the dental field, Most of the students in our program is more in the acute sector, although generally there's shifting towards the community-based sector. Less on primary healthcare, but more on RNs, nurse practitioners who work in primary care. So things are shifting towards towards the community-based side of things. Um, um, I could suggest if you want to explore how this program does relate to the dental field, you could try maybe one course, the Canadian Health System course, to get that broad overview, and then based on that, make your strategy. Melissa asks about executive roles in leadership and how this program will help with that. Um, uh, the nature of study in the program is probably getting close to director level. So that would be frontline, supervisor, managerial, and director level. So it's kind of aiming at the fourth level in the hierarchy of an organization, as well as the managerial level. So we do have some students who are in director roles, but not so many who are in beyond roles like vice president, executive director, and so on, although there are a couple. Um, um, how will this help you with executive leadership? A lot of the getting into executive leadership roles relates to what you also do in the workplace, projects completed, the budget that you manage, and the current need of the organization. I could maybe talk with you, Melissa, later on about maybe learning more about where you're at and which courses may be helpful or not. Maybe we can do that outside of this call. So feel free to email me after if you want to do that. Okay, so other questions. Kathy asks about how employers feel about this credential. Employers in British Columbia and actually in many health systems reference the LEADS in a caring environment framework. This is the leadership competency profile in Canada. And it's also oftentimes referenced as part of managerial roles in the system. So if you go look at Fraser Health, for example, and look up leads in the caring environment, you'll see reference to that. In terms of value towards credentials, it's often a mix of your prior credentials, so your base knowledge, and then adding health leadership onto that, and then having a good fit between what the organizational needs at the moment and what you can bring to the table. What we do in this program, especially through the Integrative project, it's an opportunity to demonstrate your knowledge with a sponsor, and that's often used as a gateway towards advancing in one's career. I've written about 4 reference letters for students to go on to graduate level studies, as well as people sometimes change roles even when they're in the program. So prior to graduation, they take on clinical managerial roles, become leads in their own departments, and so on. So waiting to complete a program is not always the best way to kind of advance yourself. You could advance even while you're in the midst of study. Okay, Christina asks a question about Royal Roads giving grads a link to their certification course. So students do achieve transfer credits between BCIT and other post-secondaries, so UBC's, MHA, Athabasca's Nursing Leadership, Royal Roads program, and so on. So these transfer credits are done between the students kind of acting as the intermediary between the 2 programs. At this time, we don't have a formal laddering arrangement with Royal Roads, but we share information as to the number of graduates that are coming out of our program, proceeding to theirs, and so on. But students do proceed to graduate level studies after this program. I'd say maybe 2 out of 20 or maybe 3 out of 20 people on average. Okay, a lot of questions coming in. So we're getting close to the end of our conference. There's about 5 minutes left. I just wanted to make sure that we all know what next steps are going to be. So Can you go back, please, Darren, to the next step slide, and I'll just restate some of that here. So in terms of what to do next, take a look at our website. All the information is there in terms of the logistics of getting involved in the program, either as a formally admitted student to the program, how to apply, or taking a course a la carte. As well, there's program advising for support, and you can also get in touch with our department, with me specifically, to get an assessment or a consultation about next steps in the program. So we did race through quite a lot of topics today and quite a lot of questions towards the end. And I think we've addressed most of them, maybe not all of them, but take the opportunity to get your questions answered by reaching out to BCIT. Maybe I can turn the floor to Janice. Janice, do you have suggestions for those on the call today?
I was just wanting to make one comment, which is a common question that we receive regarding foreign trained professionals and the English requirement. There was a previous question regarding the IELTS. So the IELTS is an acceptable assessment test at BCIT. For this particular program, you do have to do the academic stream, and it has a recency of 2 years. So you have to have done it within the last 2 years, and you would need to achieve a 7 overall or higher in that assessment test to qualify for the English entrance requirement for this particular program. There are other assessments that we accept as well, but the IELTS does tend to be the most common. I just thought that I would add that.
Thank you, Janice. Darren, maybe you could let us know if there's anything else to cover as we prepare to close the call.
No, thank you very much. You guys gave some excellent information, and just wanted to reiterate what you said earlier about a copy of the slide presentation being sent out to all the registrants maybe early next week. And also should have a link to this presentation on YouTube. And I believe that's it. I really just want to thank everyone for being with us today, and definitely wish you all the best of luck in your future in health sciences or leadership. And I believe that's it.
Great.
So thank you all.